Welcome to Dr. Dean's webinars on healthcare, and today we're going to talk about should I buy health insurance or not? For those of you who don't know me, my name is Dean Waldman, and I was a pediatric cardiologist for 37 years. I'm currently Professor Emeritus in Pediatrics, Pathology, and Decision Science, so appointed in both the medical school and the management school. In addition, I serve on the board of directors of the New Mexico Health Exchange and am the author of the book, The Cancer in the American Healthcare System. Today we're going to talk about the following. Number one, I'm going to ask you some questions about do you believe the following things, and I'll show you. Number two, we're going to talk about what insurance is. And thirdly, we're going to talk about the concept that the winner in insurance does not collect. Health insurance is different even from other forms of insurance, and we need to go over that. Finally, we're going to talk about should you buy insurance or not, and if so, why? And lastly, other things you need to do to help yourself and protect yourself from our healthcare system. Starting with, do you believe that the purpose of insurance is to pay for your care? Do you believe that insurance premiums cover the cost of health care? Do you think it's a good idea when you collect on your insurance? Obamacare insurance and health care, is it free? Health care is a right. Of course, you don't have to pay for a right, but is health care a right? There are many people who think that single payer or the public option will save us from the mess that we're in now. The fact is, all of these are myths. They simply are not true. Let's start with what insurance is. Insurance is a betting pool. A large number of people put in small amounts of money, and a small number of people take out large amounts of money. Now let's start with something that you know, which is the lottery. A lot of people put money into the lottery, but only a rare person actually wins and takes money out. Now here's the but. Insurance is a different kind of a betting pool. In the lottery, in bingo, at the racetrack, the winner collects money. With insurance, it's the loser who collects money. What do I mean? Well, start with something you know. Auto insurance. Everybody's got it, I hope. When do you collect? That's when you collect, when you're in an accident. With insurance, only the loser collects. How about your homeowner's insurance? Well, after the hurricane, you collected. Let me ask you this. Do you think that you won or you lost? Because that's what your house looks like. In point of fact, you buy insurance to prevent financial catastrophe. Then there is, of course, life insurance, which is a lifesaver for you. No, it isn't. The winners are your heirs. You lose. You lose your life. In the insurance betting pool, the winner does not collect. And the same is true of health insurance, only more so. Now, let's talk about health insurance for a second. You want to stay healthy? You want to live a long time? Everybody does. Health insurance does not insure your health. Like all forms of insurance, health insurance is the following. Many people pay for the needs of the few. The winner is the one who doesn't collect, because if you think about it, that's the person who stays healthy. And insurance is intended to prevent financial disaster. Health insurance was not designed to pay for your care. What does that mean when I say health insurance was not designed to pay for your care? Well, first, it means that it was not designed to improve the quality of your health or how long you live. It was designed, like all other forms of insurance, to prevent financial disaster in the event of a major event, an expensive illness. Now, let's face it, any serious illness is expensive. If you have to go into the ICU, $3,000 to $10,000 a day. Hello. If you have hepatitis C, as over 3 million people in the United States do, a bottle of Sovaldi is $1,000. No, that's not true. It's $1,000 a pill. So why buy insurance? Again, well, first, without it, you cannot afford routine or preventative care. You certainly cannot afford any complex care. After 2017, you will be penalized 2.5% of your gross income according to the Affordable Care Act. Now, you can always get care through the emergency room, usually after a very long wait. And then you get a bill that you can't possibly pay. So now again, why buy health insurance? Because with insurance, you're much more likely to be able to access the care system and to find a provider who may care for you. The insurance does pay for much of your care, but remember, it's much, it's not all. Care is never free. Having health insurance doesn't eliminate, but reduces the risk of bankruptcy. And certainly it increases the size of the betting pool so that there's more people to pay for the people, more money to pay for the people who are sick. So, what are your steps? What do you need to do to protect yourself? Number one, you should buy health insurance. Number two, you should go to the website wecanfixhealthcare.info, not .com, and you should consider the information. There's lots more than what I've said at this webinar on the website, and it's all free. There are other webinars about healthcare available to you. They're also free. Just access them through the website. And finally, I urge you to read The Cancer in the American Healthcare System, because that will answer your questions and, more importantly, will show you the way to actually fix our broken healthcare system.